I'm Tsung-Mei Cheng from the Woodrow Wilson School of Public and International Affairs of Princeton University of the United States.
And what brings you to Abu Dhabi for this Congress?
Well, I came here to share some of my research work and also to learn from others. This is a tremendous venue for people to meet. It's a mutual learning environment, and also it's a wonderful environment for networking. You meet people, so it's sharing and networking. It's great.
Can you tell us about your research?
Well, I do comparative health policy studies with a focus on East Asian systems. I mean, the latest, my latest work is with the Chinese health reform and also with Taiwan's health system reforms.
Can you tell us what's happening with China's health reform?
Well, my overarching statement regarding what's happening in China's health reform is that it is really an ambitious and all-encompassing reform, and the government is putting a lot of resources, which is a very, very essential, important thing to do. Otherwise, it's just empty talk. The Chinese health system has had a major setback in the period from the late 70s through the early 2000s. This was a period where the commune system fell apart, and when China decided to do reform and opening and build basically a capitalist system with Chinese characteristics, and what happened to the healthcare sector with the reform opening is that the government decided to reform and open the Chinese health system or health market. But that led to a lot of loss or reduction in healthcare resources because the government stopped giving money to the public hospitals and told them to sink or swim, to fend for yourselves. And so this led to a lot of irregularities, shall we say, by China's healthcare providers. But I would say that you cannot really blame them, because how are you going to operate a hospital when there's no capital coming in? So the hospital had to really just charge patients and sell a lot of drugs, sell a lot of high-tech exams, procedures. But then this, of course, led to the burden, the financial burden on the people to become unbearable, because in this same period, they did not have a good health insurance system. The majority of the rural population in China in this period had no health insurance. And in the urban areas, only roughly half, if that, had any kind of insurance. So people found access to healthcare difficult, if not impossible. And they also found healthcare unaffordable because it was just too expensive. People's income didn't match the cost, the growth in the cost of healthcare. And so this in fact created a very serious social problem. You hear the voices of people, access hard, healthcare unaffordable. It was a very sad period. A 2006 government study showed that healthcare problems was the #1 concern for China. And so it decided to do something. So this was the background. All of that was the background to the latest reform. So from the early 2000s on, China started to think about how should we go about changing things. And so I won't go into the details and just go directly to what they came out with. starting in 2000, April of 2000, April 6, 2009. They have this. They pushed out a comprehensive reform plan that aims to provide health insurance coverage for every Chinese. Universal coverage is their aim. And today, as we speak, in December 2010, over 90% of the Chinese have health insurance coverage. And then they aim to provide, see, drug expenditure is a very big expenditure in Chinese healthcare. And so the government said, well, we're going to make sure that the drugs are safe and there's adequate supply, and that people can afford the cost. So they created an essential drug list based on the WHO guidelines. And then third, they said, well, we need to build infrastructure. We need more hospitals, more beds, more nurses, more doctors, and further train what we have, but train new ones. That's three. And then the fourth one is that they're aiming to broaden their public health services with the emphasis on women and children, immunization, health education and promotion, and that type of thing. And then the fifth key to this reform is reform of China's public hospitals. That is a huge task, very, very important. But they're going about it in a very, very systematic way. And most importantly, I would say that the determination is there, leadership is there. So I'm very hopeful.